Hey everyone, I'm Allison. In this video, we are going to discuss legal liability risk reduction strategies for new nurse practitioners transitioning into practice. We're going to cover Tennessee scope, practice laws, the 7 C's of malpractice prevention, common liability risks, and practical strategies to help us practice safely, ethically, and confidently. Starting off, I currently live in Tennessee, which is a reduced practice state. And this means that the APRN must have a collaborating physician for the entirety of their practice. This physician must hold a valid license in the state of Tennessee and comply with the Medical Board of Examiners, as well as review at least 20% of patient charts and have at least one on-site visit every 30 days. Some more regulations that Tennessee has on the APRN is they cannot practice telehealth visits with patients that live outside of Tennessee. The APRN and the physician must both hold a valid license in the state where the patient resides. I can see this encounter happening and being problematic, especially for those that are practicing in Memphis, because we are so close to Mississippi. So that's something that the APRN needs to be aware of, that if her patient resides in another state, they cannot have telehealth visits. Next, we're going to talk about the 7 C's of malpractice prevention and discuss some examples to reduce those risks. The first C is care, treating patients with empathy, respect, and professionalism. The second C is communication, actively listening and explaining diagnoses and treatment plans. And one way we can reduce this risk is communicating in a simple way that patients understand. We want to avoid the medical jargon and have them repeat back their plan of care to make sure they truly understand what they're supposed to be doing. The next C is consent. This is making sure patients understand the treatment, any alternatives, the risk and benefit, and the expected outcomes prior to the treatment. The fourth C is competence, which is staying within your scope of practice and knowing your limitations, and staying up to date on evidence-based guidelines. Next is charting. We all know the saying, if it wasn't charted, it wasn't done. This is the same for APRNs. We want to make sure that we document all patient interactions objectively. The sixth C is confidentiality, and this is complying with HIPAA. We want to make sure that we are not discussing private patient information outside of the setting of collaborating with your physician or experienced nurse practitioners for the need of the patient. Otherwise, out to dinner or in the hallways, we want to avoid talking about patient information, and this will help reduce the legal risk of confidentiality. The last C is consultation, and this is knowing when to seek help, whether that be with the collaborating physician or referring out. For example, if you have a patient come in with an arm injury and an x-ray reveals a break that is out of your scope of practice to treat, you want to refer them to orthopedics, which demonstrates effective consultation. Next, we're going to discuss common liability risks and mitigation. One of the most common malpractice claims is diagnostic errors. This is misdiagnoses or a delay in diagnosis. And to prevent this, we want to make sure we complete a thorough history and physical exam and order appropriate labs and diagnostics in a timely manner. Next is prescribing errors. This includes incorrect dosage, not reviewing medication allergies, and not reviewing labs prior to prescribing. This could lead to prescribing errors. Next is boundary violations, maintaining professional boundaries, so avoiding personal relationships with patients, maintaining professionalism on social media, and this doesn't only protect the patient, but it protects the provider. And lastly, poor documentation, incomplete charting or bare minimum charting. Like we discussed earlier, we want to make sure that we document everything objectively. We want to include refusals, education, assessments, plans, and all of these things can reduce the risk of legal liability if something were to happen. As I transition into a new nurse practitioner, some of the strategies I plan on using are the thorough and accurate documentation, a mentorship through experienced NPs or collaborating physicians in the setting that I'm in, staying up to date on the most recent guidelines and protocols, and carrying malpractice insurance outside of what my employer provides. To conclude this video, I want to highlight that NPs transitioning into practice must not only be clinically competent, but they must also be ethically and legally aware. It's important as future NPs to continue learning, remain vigilant, and communicate effectively, and always stay within our scope, to know our scope and stay within our scope. We want to avoid malpractice, but truly it's about delivering quality, compassionate care. Thank you for listening, and I look forward to hearing your thoughts in the discussion.